So in Ayurveda, the most important thing, whenever we are checking the imbalances, we have to check the Prakriti. What is your body type? And Prakriti we check with the watching you, what you look, how you look, and then we check the pulse, and then we ask the questions. Not, it is not necessarily that what you are looking like this, you are always like this. So we have to check your past, we have to check your family, and then we ask many questions also. And we compare your body type with your family to decide your Prakriti. Once we decide the Prakriti, then we check the pulse. Pulse always we check on the root of the thumb. We check 3 pulse. First pulse is Vata, second pulse is Pitta, and third pulse is Kapha. So the middle pulse is Pitta. So whenever we check pulse, first thing it should be morning time, empty stomach, or at least 3 hours without food. If you are checking with food, then the pulse will be different. And we check always both hands pulse, not in one hand. Sometimes the imbalance in only in one side of the body. Then you have to compare with the other side of the body also. So then once you diagnose the pulse according to the condition, if you are in a movement, Vata pulse will be high. If you eat food, within 3 hours you are checking pulse, Pitta pulse will be high. When you are sleepy, you are tired, you eat a lot, Kapha pulse will be high. So that's why most accurate pulse either morning time, either 3 hours after food. Then we always check with the eyes. The down of the eyes we check with the anemia. The person has how is the hemoglobin level, we check in this eyes. So sometimes people get vegetarian, vegan, low iron, you can check in the eyes. Sometimes we look upper side, we look down, we to look this part of the eye, we check with the color. It's a yellow, it's a bluish or like this. One we can check Prakriti, and if it is yellowish, we can say it's like a liver problem. Then we check hairs. Hairs are thin, thick, the texture. So to check Vata, Pitta, Kapha. Then we check the nails. So nails shape, nail size, the soft, brittle, any kind of spots in the nails. And we check the tongue also. The normal tongue is light pink, like this looks like a normal tongue. And we check if it is head coating, white coating, grey coating, yellowish coating, what is the taste of your mouth, how you feel thirsty or not. Then we check teeth. The teeth, we check what is the color. So if it is yellowish color, we will say this is Pitta. When it's ridges, the unformed teeth, different shape, this is Pitta teeth. Then we check the cavities. So it shows the dehydration. So if you are not drinking enough water, you can have possibility more tooth caries also. If somebody has gum swelling, gum bleeding, this is a Pitta issue. So we check like these kind of things, we check the body color, and then we decide the Prakriti. And then we talk about the imbalances.
Okay. So through all these checkings, you
Yeah,
can
we collect the
all the
information,
information
and then we can say this person, look, this is your Prakriti and your pulse is coming this age. This is your difference between Prakriti and Vikriti, the pulse, and this is your Vikriti, this is your disturbance. And now this point you have to work.
Okay, and through all these checks, you can say, okay, this is your dosha.
The dominating dosha is this, and this you have to work on this dosha or some other dosha like this.
Okay, and can you also see imbalances in my body through, I don't know, looking
Yeah.
at my eyes, my
Yeah.
tongue, my...
Yeah, we see the, like if your tongue is white coated, we will say the kapha is not working. If it is dark coating, dryness of mouth, lots of cavity, this is vata. And if you have sour taste, metallic taste, yellow, greenish, reddish tongue, stomatitis, this is pitta. And then with the eye color also we suggest that if you have a sclera is bluish, it is the vata. If it is yellowish or reddish, it is pitta. If it is more whitish, it is kapha. So like with these features also we consider to decide the prakriti.